So let us start with the MCQs on gynecology. These questions are very important for the upcoming nursing competitive exams. So first question is, abnormal proliferation of uterine endometrial tissue outside the uterus is known as cystic fibrosis, endometriosis, metrorrhagia, menorrhagia. The correct answer is endometriosis. So abnormal proliferation of uterine endometrial tissue outside the uterus is known as endometriosis. Next, painful menstruation is termed as menorrhagia, dysmenorrhea, amenorrhea, decreased production of prostaglandins. Correct answer is dysmenorrhea. So you can see all the questions, most of the questions I have selected from the previous year questions which have come in the competitive exams. So these questions are already very important. Commonest complications of IUD insertion is, IUD is intrauterine device. So commonest complication of IUD insertion is pain, bleeding, perforation, ectopic pregnancy. Correct answer is bleeding. So bleeding is the most common complication of IUD insertion. In most of the cases of IUD insertion we can see bleeding. Next, Radha, a 30 years old woman, asked the nurse about the preventive measures for cervical cancer. What will be the appropriate answer by the nurse? So Radha is a 30 years old, means a middle-aged woman, and she asks about the preventive measures for cervical cancer, how she could prevent cervical cancer. So the correct answer would be, the options are avoidance of early marriage, be faithful towards own husbands, maintain at least 3 years gap between 2 pregnancies, and all of the above. So the correct answer is all of the above. So avoidance of early marriage and be faithful towards your own husband and maintain at least 3 years of gap between 2 pregnancies. These are the steps which we can take to prevent cervical cancer. Next, contraceptive pills helps in birth control by killing ova, preventing ovulation, killing of sperms, forming barrier between sperms and ova. Correct answer is preventing ovulation. So contraceptive and pills helps in birth control by preventing ovulation. They prevent the ovulation and thus helps in birth control. Next, absence of menstrual cycle for 6 months or more. 6 months or more there is no menstrual cycle in a female who has normal menstruation previously is termed as. So female who has normal menstruation previously but suddenly her menstruation is stopped for 6 months or more. So this case will be cryptomenorrhea, dysmenorrhea, primary amenorrhea or secondary amenorrhea. Correct answer is secondary amenorrhea. Amenorrhea means absence of menstruation. Primary amenorrhea is when there is absence of menstruation from the beginning. The menstruation has not started. That is primary amenorrhea. But secondary amenorrhea is when a female already has menstruation. It started the menstruation cycle, but suddenly the menstruation has stopped for 6 months or more than that. So it will be termed as secondary amenorrhea. Next question. Polycystic ovarian disease may cause secondary amenorrhea. Polycystic ovarian disease may cause secondary amenorrhea due to excessive production of estrogen, excessive production of FSH. FSH means follicle stimulating hormone, excessive production of androgens and all. So correct answer is excessive production of androgens. Next, what is the full form of NSV? It is very important question. What is the full form of NSV? No suturing vas deferens, no scalpel vas deferens, non-scalpel vasectomy, no suitable vasectomy. So the correct answer is non-scalpel vasectomy. Without using any scalpel, without the surgery, when vasectomy is done, that is non-scalpel vasectomy, NSV. Next, clinical manifestation of genital prolapse. Genital prolapse, we will all know. Clinical manifestation of genital prolapse. It includes dysuria, backache, difficulty in passing stool, all. Correct answer is all. Dysuria means difficulty in passing urine, backache and difficulty in passing stool. All of the symptoms are seen in genital prolapse. Next and the last question. The condition in which complete uterus turns backwards in relation to the long axis of birth canal is termed as retroversion of uterus, anteversion of uterus, prolapse of uterus, anteflexion of uterus. The correct option is retroversion of uterus. So these are all the important 10 questions I have selected from the previous year questions and the most important questions from gynecology. Please study this for the upcoming nursing competitive exams. Thank you. See you in the next video.